Hello, everyone. Good morning to one and all. I'm Dr. Rini Brar from the RFA team. And today we are going to discuss and talk about Ielts. This is one of RFA's series of Know Your Exam, that before attempting any exam, before preparing for any exam, we need to know what the exam is all about. So continuing that tradition, we're going to open our IELTS session with the Know Your Exam presentation today, right? I welcome all of you, my dear friends. I see here we have Dr. Ankita, Vaishali, Kirti, Kusum, Madhi, Dr. Maskura, Dr. Noor Hafiza, Dr. Uruj, Rabia, Samareen, Sayali, Tamannam, and Dr. Sivaranjani. Hello, very warm hello. So, I welcome you all. And what are we going to discuss about today? We are going to discuss which exam to take. Now we have cleared our MRCOGs and we know that the next step is GMC registration. But to get ourselves registered with GMC, we have to fulfill their condition that we have to clear a language test. It could be either IELTS or it could be OET. So which one is better for you, depending upon your individual situation, your strengths, and your weaknesses. So we're going to decide that today, right? The second thing is, in IELTS as well, we have general IELTS, academic IELTS, UKVI, non-UKVI. So which of the exams can we take in order to register ourselves? What is the pattern of the exam? Before starting to prepare for the exam, we need to know how the exam is conducted. What is the structure of the exam? Because if we know the pattern and structure, only then we can prepare properly for the exam and score what we want to score in the first single attempt itself. So we are going to see what is the pattern and structure of the exam. The next thing is we're going to see how much score is required for the exam. For GMC registration, how long the results will be valid for. This is an important point because there are a lot of candidates and our colleagues who wait a bit before getting themselves registered with GMC. So if you take the test today, how long are the results valid for? And how to book for the test. And lastly, and the most importantly, how to prepare for this test, right? So let's take up all of these one by one and first learn the comparative differences between IELTS and OET. The most important thing is that they are both very fundamentally different. See, IELTS is a test of English, overall English. It has not been made to subjectively test your knowledge in a healthcare setting. This is the most important difference, that IELTS does not check your knowledge of English in the healthcare setting. It is a test of overall English. Compared to OET, this has specifically been made for healthcare professionals, be it doctors, be it nurses, be it paramedical staffs, medical technicians, etc. This is the basic and core difference between the two of them. So how does this make both the tests different is, both IELTS and OET have 4 different modules to them, which are listening, reading, writing, and speaking. And each of the modules are different fundamentally based on this. For example, if we are doing the writing module, in the IELTS, the writing exam is going to assess your ability to write an essay. That is, to construct, to think what the essay is going to be about, to form a rough essay's outline in your mind, and then to produce a piece of writing. For example, you would be expected to produce at a university. So this is not going to test anything in relation to a healthcare setting, but in a general context. For example, they'll ask you that write an essay on fast foods and carbonated drinks are leading to obesity. Do you agree to this or not? So you see, this is not in a task which is specific for healthcare workers. In comparison to that, OET is going to assess your ability to communicate when writing in a healthcare context. For example, if you are assuming you are a GP and you have to write a letter of referral to a specialist doctor, or for that matter, you are a specialist doctor working in a ward and you have to write a discharge letter for a patient. So it's going to assess your ability, particularly in the healthcare setting context. Now, for some people, this may be difficult. The difficulty level may be different. For some people may think that they are more easily able to produce something related to obesity and fast food. They can say, oh yes, there are a lot of carbonated drinks in the industry at the moment, and television advertising, internet advertising has increased the intake. This has led to an increased incidence of obesity in children. Obesity has a lot of complications associated with it, a lot of healthcare risks, so this should be reduced. Some people may find this easy. Some people may find this easy that since they are in practice in the NHS, they may find writing in the healthcare context easier. But for somebody who is out of NHS, for example, who is somebody from South Asian countries, Pakistan, Bangladesh, India, they are not in the habit of writing discharge letters in the pattern that is required for NHS or in order to clear OET. They are not in the habit of writing letters directed to GP or directed to a specialty referral. So some people, depending upon your experience, somebody may find IELTS easier and somebody may find OET easier. Similarly, if we talk about the speaking exam, in IELTS, your speaking exam is going to assess your ability to communicate clearly in an interview format, discussing ideas and topics that are not relevant to a healthcare professional. Compared to that, the OET speaking exam is going to assess your ability to communicate effectively in the workplace. For example, building relationships with your patients in the format of role plays. So what does this mean? If I give you an example like I gave for the writing exam, if I give you an example for speaking exam, in IELTS, what is going to happen is your examiner is sitting in front of you. You are seated here. Your examiner is going to start your speaking exam by asking you more about yourself. Okay, Dr. Rini, tell me more about yourself. Okay, what are your hobbies? Okay, when was your last vacation? What did you particularly like about that vacation? How would you like to make your future vacations better? So this a very general talk. Compared to OET, they are going to assess whether you are able to communicate effectively with your patients or with your colleagues or with your seniors and juniors, right? So this is how IELTS and OET are inherently and fundamentally different from one another. Then there are some differences based on the, for example, test centers, the fee, and so logistical differences. Like for IELTS, there are a lot of test centers. There are more than 15 in India, and every major city has a test center for IELTS. Some cities have more than 2 or 3 centers as well. Comparing that to OET, there are a lot of centers available in South India, but in North, Chandigarh and Delhi have one each. So depending on the country that you will be appearing from, you will have to check the availability of the test centers. And the most important difference where IELTS does considerably better than OET is that the price for UKVI academic IELTS. So this is the IELTS that you would be requiring in order to get your GMC registration. So the price of UKVI academic IELTS is 160 GBP compared to the price of OET, which is 460 GBP, which is 2.5 to 3.5 times more expensive. Okay. And slots are available every week for IELTS. For OET, slots are comparatively less easier available, but they're also available every month. Results for both are available in 1 to 2 weeks. IELTS is a universally accepted exam in the sense that any university, any hospital, you may go anywhere in the world apart from a few countries, that IELTS is going to be accepted there. Compared to OET, OET is less universally accepted. So inherently what this leads to is that there's a lot of preparing material, advice, and a lot of courses and videos that are available for IELTS, while the same may not be true for OET. If you have to prepare by yourself for IELTS, it is easier because there are set courses, set pattern, a lot of material is freely available on the internet, but it's not the case for OET. So after understanding all the differences, which one is easier? Because ultimately we want to get a registration, we want to start practicing as doctors in the UK. So which is going to be easier? And the answer is that none of them is easier. No exam is superior, inferior, easier, or more difficult than the other. As I said, both are different, both test different things. It's going to depend upon your strengths and weaknesses. So if a student's English is not up to the required standard, then she will not be able to pass either of the tests. In short, that if a student's English level is good enough, then it does not matter which test is easier. And as such, there's no evidence that shows which test is easier, IELTS or OET. But that said, there are some kind of talks going around which say that they are making OET more difficult in terms of listening and reading. But there's no proof of that. So it does not matter which one is easier, because both the exams require serious preparation, and the amount of preparation required for the both of them is the same. If for OET, you have to practice 2 letters each for writing, same is the case for IELTS. You have to practice 2 letters each for IELTS. If you have to practice speaking for OET with your study partner, similarly, you will have to practice speaking for IELTS with your study partner. Same about listening and reading. Listening and reading you can do by yourself. They are easier, relatively easier. You have to practice listening and reading by yourself or with the help of a mentor for both IELTS and OET. That said, there have been many candidates who have had to repeat either IELTS or OET at least twice or thrice. So this is to say that both of them require serious preparation. It's not that one exam is easier, one is difficult. So how do you decide then? So the first thing is a personal choice. Like I said, somebody who may not be practicing in the NHS, is not in the UK, may be more comfortable with IELTS than OET. But it does depend upon your individual circumstances. The second important thing is finances, because IELTS is a relatively cheaper test compared to OET. OET is an expensive test. It is 2.5 to 3.5 times more expensive than IELTS. We've already spent so much on registration itself is going to cost you. So we've spent on exams, we've spent on college memberships, then we will be spending money on GMC registrations, then visa is going to come there. So somebody who is good in English may think that if the preparation required is same for the both, why not go for IELTS? So ultimately, this is your personal choice. You have to ask yourself, okay? I've given you all the pros and cons. You can decide which one is going to be easier for you. In case you need any help from the RFA team to help you decide which is better, you can ask in the end in the Q&A session. Okay, so this is about IELTS versus OET. If you have decided that you want to take the IELTS exam, so what exam to take? There are 2 types of IELTS. One is for global migration, which is known as IELTS, and the other is specifically for visa applications to the UK. So for UK, you're going to choose IELTS for UKVI. Then there are 2 more types. One is academic IELTS, one is general training IELTS. Academic IELTS is for professional registrations, for example, GMC registration, or to study for graduate or postgraduate levels. General training is for training or studying at undergraduate levels. So if you're looking as MBBS doctors, we have to do, and wishing to go to UK, we have to do IELTS for UKVI, and it is going to be of the academic type. Okay. Then the next thing is, what is the pattern of the exam? There are 2 patterns. One is pen and paper, in which you have to go to the test center and you have to carry out your exam in the test center using a pen and a paper they will be providing you. The second option is a computer-based exam. You can sit at home and take the test, or you have to go to the test center to take the test. Now here somebody may ask, which one is easier? Same is the answer here. None of them is easier. Both are the same set levels of exams. Somebody, like most of us are millennials, so we may be finding pen and paper easier, right? And most of the doctors who are Gen Z doctors, they may find computer-based easier because they've been in the habits of being closer to screens since they were young kids. While, for example, if I have to choose, I'm going to choose pen and paper because I'm more comfortable with pen and paper compared to computer because of my age. And the next thing is, what is the structure of the exam? So just like OET, IELTS exam also has 4 modules. listening, reading, writing, which is abbreviated as LRW, or speaking. Okay. In listening, we have 4 tasks. 1, 2, 3, 4. In reading, we have 3 tasks. 1, 2, 3. In writing, we have 2, and in speaking, we have 1. So simply 4, 3, 2, 1. Listening 4, reading 3, writing 2, speaking 1. So this is the basic structure or the backbone or scaffolding for the exam. Coming to all the modules individually, right? So let's talk about listening module. In listening module, as I've said, that they're going to give you 4 tasks. So what are going to be the 4 tasks? So if you are in the exam center using your pen and paper, or if you are using a computer-based test, so you will be given headphones or earphones. You have to, apply your headphones or earphones, and they're going to play audios, right? They will be pre-recorded audios. They could be monologues, that is just one person is speaking, or they could be conversations, that is 2 individuals maybe speaking to one another, and you have to listen to their conversations. So you listen to these audios, and side by side, you will be having your question paper and your answer sheet. So you listen to it, the audios, and then side by side, you keep on answering questions on the answer sheet. Okay, clear? So there are going to be total of 40 questions. Each task 1, 2, 3, 4 will have 10 questions. So total 40 questions. Now there are a different variety of questions that are asked. They could be multiple choice questions. They could be match the following questions, label the diagram, or complete the sentence, fill in the blanks, etc. So you're going to be listening to the audios. And for example, if they have said 2 individuals are talking and they're saying, oh, the exam is going to be difficult. In the fill in the blanks question, it will be written, what does John say about the exam? That it is dash. So you're going to write difficult. The important thing is that you only hear the recordings once. So you have to be very, very attentive throughout. People say that listening module is the easiest module. Yes, that's true. Listening is very, very easy. But it is only easy if you are very attentive, because you will only hear the recordings just once. Okay. So you'll be getting 30 minutes to listen to the audios, and then 10 minutes to transfer the answers to the answer sheet from the question paper. So total, it's going to be 40 minutes for the listening module. I hope I'm clear about the listening module. And if I have to give an example, this is how your question paper is going to look like. You will be wearing your earphones. Somebody would be talking about Packham's shipping agency, and you have to be filling in the blanks, like name Jacob, dash means what's the surname of Jacob. They would be talking about these things when you will be listening to them. So this is how a question paper from the listening module looks like. So this was module number 1, listening, which has 4 tasks. Next, we come to reading module. In reading, there are 3 tasks, which are writings, that is different paragraphs in one. They're kind of like essays. They may be taken from newspapers or journals or books, and you have to read the write-up and answer questions on the answer sheet. There are total 40 questions, and there are different types of questions. Same as listening, there are different types of questions. They could be multiple choice, they could be match the following, fill in the blanks, yes, no type questions, true, false, or not given, table completion, flowchart completion. So if you're going to choose the RFA Ielts courses, we're going to teach you all the different types and how to solve all the different types of questions from the reading module. There are 2 modules that students find particularly difficult. One is reading and one is writing. Listening and speaking, generally, all the doctors are able to do and score as much as required. These 2 are difficult, and we have a lot of tricks as to how to answer the reading and the writing. So for reading also, you will be given 60 minutes, that is 20 minutes per task. Clear? Okay. If I have to give you an example of the reading module, this is how it looks like. So like, for example, in the note, they've written that this is an extract from academic reading passage on the subject of dung beetles. So this is the entirety of the paragraph, and then they give you questions like this. They're written different type of species of dung beetles. What are the sizes? What are the preferred climates? Complementary species, start of active period, number of generations. So this is an example of fill in the blanks for the reading tasks. So we are done with 2 tasks. One is listening and one is reading. Next, we come to writing. we had 4 tasks in listening, 3 in writing, 3 in reading, and 2 in writing. In writing, there are 2 tasks that you will be given. The first task is the shorter one. This second task is the longer one. And second task is also the more important one. Because task 1, you have to write just 250 words, but for task 2, you have to write 250 words, which is essentially a full paragraph. And task 2 contributes twice as much as task 1 to the final score. Okay, so if I have to give you examples of both the tasks, task 1 would be that you look at a diagram. It could be a map, it could be a graph, a table, or a chart, and then you present the information in your own words, right? Compared to task 2, you have to write an essay on a topic, which could be, as I said, opinion about obesity or problems like obesity in children, like that kind of opinions. You may feel, is technology good or is technology bad? Are televisions good or are televisions bad for children? So general topics, okay? So here also, this would be for 60 minutes. And you're advised to spend 20 minutes on the first task and 40 minutes on the second task, because second task is almost twice in terms of words as well as in terms of score. And then we come on, this is the example of the task. On the left is the task. These are task examples of task 1s. Like you have been given a diagram. If you look at your left side, they've given you a chart in which they have shown the number of men and women who are pursuing further education in 3 periods, right? And then whether they were studying, whether they were full-time education or part-time education. And then you have to summarize all of this, reporting the main features and making comparisons. So this you have to do in 150 words. Similarly, on the right-hand side, you see they've given you a flow chart of how the bricks are manufactured, and then you have to write it down in your words, in 150 words. The diagram things are task number 1, and task number 2 is your opinions or views or commentaries. Like there's one task, they've said children who are brought up in families that do not have large amounts of money are better prepared to deal with the problems of adult life than children brought up by wealthy parents. So they've given you a statement that children who belong to families who do not have much money are better prepared to deal with problems compared to children who belong to rich families. So do you agree to this? And to what extent do you agree or disagree to this? So this is like a general statement. So you have to write 250 words on this general topic. Similarly, there's another example that international tourism has brought enormous benefits to many places. And at the same time, there is concern about the tourism's impact on local inhabitants and environment. So do the disadvantages of international tourism outweigh the advantages? So basically you think about the topic, you form a rough frame in your mind that is tourism helpful? Okay, yeah, it brings a lot of economy into the country. What are the disadvantages? That a lot of space is taken up, a lot of money is taken up. And so that kind of a thing. So you think in your brain and then you formulate an essay, a general essay, not specifically a medical essay. And this is how you do your writing tasks. The last module is speaking. You are given 11 to 14 minutes for the speaking module, and it is done in 3 parts. Like I said, the examiner is going to be sitting in front of you. In the first part, they will ask you to introduce yourselves. If they will ask you general questions like, how are you? Tell me about yourself. Who all are the members of your family? What are your hobbies? Where do you work? Etc. These are easier questions. You just have to talk about yourself. And in second part, you will be given a cue card. That is, you will be given a slip of paper and there will be written a topic on that paper. For example, there will be written favorite vacation or last vacation. Then after giving you that cue card, they will give you 1 minute to prepare and take notes. So you can think about your last vacation. Okay, my last vacation was to so-and-so place and we had gone by car and we had eaten here, and these are all the places that we had visited. Did you enjoy? Did you not enjoy? Was it expensive, not expensive? So you think about that for a minute. And then the examiner is going to ask you a couple of questions on the same topic. And the third part is going to be, that the examiner is going to give you a topic and you engage in a discussion of some issues for 4 to 5 minutes. So this is basically a general talk with the examiner. So this is how your 4 modules, this is the structure of the exam, LRW and speaking. LRW is done on one day, listening, reading, and writing, and speaking is done on another pre-decided day. Okay. And then how much do you have to score in order to get your registration? So the score that is given in IELTS is known as band. And a band in IELTS ranges from 1 to 9. 1 means that there is no knowledge of English except some isolated words. And 9 means there's an expert knowledge of English with full command of the language. And how much do you have to score from 1 to 9? You have to score at least 7 in each domain. That is listening at least 7, reading 7, speaking 7, and writing 7. But overall should be at least 7.5, which means that you may have to score at least 8 in 2 of the domains. So you can score 8 in listening, 8 in reading, 7 in writing, and 7 in speaking, and you will be through. So 8, 8, 7, 7. This is generally considered. Right, so this is the score that you have to get in order to get yourself registered with the GMC. And now what happens if you fail only one domain? For example, you've done well in listening, in reading, and writing, and just speaking is left. So there's one option known as IELTS One Skill Retake. So this is from the IELTS website. In the quotations, they've said currently the only way to take a major English language proficiency test is to take it in one session. That is sitting a test for each skill, that is listening, reading, writing, and speaking, or combined skills. With one skill retake, IELTS will be the major test, providing test takers the ability to take one section of the test again, and if required, to update their overall result. This essentially means that if you have failed speaking, you can just reapply for speaking. And if your scores for listening, reading, and writing of the previous test and speaking from the new test will be taken, and overall you will be passed. So this one skill retake is currently available only at selected test centers in Australia, but it is continuing, it will continue to roll out globally during the year. So what you have to do is you have to check your country, and you have to check the IELTS website and the GMC website, whether they started to accept the IELTS one skill retake or not. Okay, I hope it's clear. Next is how long are the results valid for? The TRF, which is the test report form of IELTS, is valid for a period of 2 years. Okay. Now, how to book for the test? This will depend on the country that you're applying for. IELTS is jointly managed by 2 companies. One is British Council and the second is IDP. In India, only IDP IELTS booking is done. British Council booking has been stopped. But you check the country that you're applying for and you book. The exams in both British Council and IDP are exactly the same. So it does not matter which company you book it from. Okay. And the last thing and the most important thing that everybody is worried about, okay, we've understood this is how the exam is going to take place. These are all the modules. This is the structure. Okay, this is how we will do the booking, but how to prepare for the exam? So you have 3 options how you can prepare for the exam. The first is that if you want to do self-study, you're really short on finances and you just want to prepare by yourself. So how do you do that? So there are a lot of YouTube videos available on doing this. So you can go through those videos and you can practice listening, reading, and writing by yourself, and you can practice speaking with a friend. So how this is helpful is, number one, you will not be spending any money to prepare. This option should be chosen by those people who have a lot of time on their hands, who are self-motivated individuals and who have a rough idea of IELTS. Right? So at least they know, okay, these are the videos that I have to go through. This is how I practice. This is the rough score I have to get. And this is, if I practice in this way, this is the score I get. So if you are a very self-motivated individual who can do it, this is a good option. And in the end, once you've prepared yourself, it is optional. Very cheap mock tests are available and it is optional. You can do a mock test to assess whether you are completely prepared or not. This is good for somebody who has motivation to do it by themselves. What happens to people who do not have this motivation and who require external motivation? So for them, there are a lot of in-person coaching centers. That is, if you check your city where you are in right now, there must be a lot of coaching centers available. You can go there and you can take coaching. The second option is similar to in-person coaching centers. There are a lot of online coaching centers also, but these are paid online classes and the charges are different for every coaching academy. They are different. So they will be able to give you the study material. That is, you won't have to, confuse yourself going through YouTube videos or confuse yourself going online, what to study, where to study from. They will give you orientation and tips and tricks, how to crack the exam, and they will keep you motivated as well. Right? And the third thing is you can take personalized classes with RFA. So RFA has been there with you in this journey for your all the exams. And now the last step, which is there, that is the language test. We are there for you to help you ace this exam as well. So similarly, as to online coaching, we have online classes available. We will be giving you all the study material that is required for you, lots of practice tests. There would be classes every week where you will be taught tips and tricks, how to quickly do your tasks and how to get the required band score. You will be given lots of homework to do so that you're up to date with the practice and you will be motivated till your exam. We are going to add you to groups where you're going to put in all the practice that you're doing. And based on your strong points and weak points, there will be lots of practice and feedback by the RFA mentors, right? So if you decide to do the IELTS through RFA, this is the link to join the course. You log in there and you get yourself registered for the course and start your journey to clear IELTS. I hope this session was helpful for all of you. And if you have any questions, the floor is yours now. Please ask away. Okay, I have the chat box open. Fatima says, is this session recorded and where can we hear it afterwards? If not possible right now. Fatima, this session is a free session and it would be put up on YouTube also. So you can check there. The link would be posted on various groups. Noor is asking how long you need roughly to prepare for IELTS. Noor, this really depends upon how good is your English. If you feel that your English is okay, you're not very weak in English, you're able to converse with other people in English, then I think 2 to 3 weeks should be good. If you feel that you're really good in English, then some people have cracked IELTS in just 1 week as well. But generally, it is advisable to prepare for 2 to 4 weeks. And if you are having a good study, then 2 to 4 weeks should be good. Which one you take personally? I didn't get your question. No, which one you take personally? Is English test compulsory? Yes, English test is compulsory in order to get yourself registered. I had taken IELTS. I did not OET. I had done IELTS. I found it, I didn't want to spend a lot of money and I knew the preparation for both is going to be the same. I'll have to prepare, work hard like any other exam. So I did IELTS for myself. And in the first attempt itself, I scored well. Actually, I had to do it twice because my IELTS got expired after 2 years. So I had to do my IELTS again. And in the second sitting also, I cleared the exam in the first test itself. Okay, that's good. So you can retake it as well. Validity of OET is also for 2 years, Dr. Jahan, Muskura Jahan. Okay, do we have any other questions? This recording also is going to be put up on YouTube. The link to register for IELTS is going to be shared with you if you're interested in joining. We're going to help you clear IELTS in your first attempt itself. Okay, we can have this conversation on the personal chat note. Can you advise a little working in UK? We can chat about this. Okay, does anybody have any other questions? I'm going to put in the link once again. So all the very, very best, doctors. I hope all of you get registered and fulfill your dreams of working in the UK. It's a lovely country, honestly. I've just reached here and I'm liking it a lot. And I hope the same for you. Bye-bye. Take care.